Welcome back once again to the Speaker X series. The Speaker X are nothing but the members of our community, Millionaire Dentist Journey, the members of any of our courses, whether they are online courses or offline courses, and those who have implemented the teachings of these courses and have created miracles in their practice. So the purpose of Speaker X series is to, interview those success stories where people have implemented this curriculum and have grown their practices by multiple times. Okay. So even if you are watching this live or recording or on the YouTube, make sure that you do not miss even a single minute of the Speaker X session, because it takes only one idea, one bullet point. It takes only one golden nugget to change your practice upside down. So stay tuned for the Speaker X and make sure that, you stay till the end. So, our today's Speaker X is an absolute, happening lady, someone who is, taking charge of practice, taking charge of practice, taking charge of life, and making it happen in her practice. Okay. So, someone from Delhi and have implemented the teachings. Yes, Dr. Mansi, unmute yourself. So friends, first of all, just give a very warm welcome and, your first greetings for Dr. Mansi Arora. So wonderful. Good to see you, Mansi, here in the hot seat in the Speaker X. So your first thoughts. Good morning.
Good morning, sir. Right now, I'm feeling a bit overwhelmed, but I'm extremely happy to be here.
Okay, wonderful. So, so you don't have to feel overwhelmed because you're someone who has worked hard, and you have you have earned this actually to be here. So just introduce yourself, because there are a lot of new people here and maybe watching it on YouTube or somewhere else. Yep.
So, good morning, everyone. I am Dr. Mansi Arora. I'm from Delhi. I did my BDS in 2005, and I started, I'm a prosthodontist. So, I started my dental journey from 2010. Since then, I'm working as a general dentist, and I'm really excited to be here and to share my story with you. As sir says, stories जो है ना वो ज़्यादा दिल तक पहुँचती हैं.
Yeah, bilkul. And see, so someone who has a practice since last like around 13, 14 years, and someone who has really worked very hard over the years. So just want to know, like, how was your initial practice? What kind of, obstacles you faced or you used to regularly face? And, how it went in the beginning, like.
So, so practice before I joined you as a mentor was a like जैसे पहले जमाने की डेंटिस्ट्री होती है ना उस तरीके की थी. Like हमें we had no clue about management, we had no clue about that we have to market ourselves. हमें लगता था हम डॉक्टर बन गए तो अपने आप हमारे पास पेशेंट्स आने लगेंगे या ग्रेजुअली जैसे धीरे धीरे हमारा करियर सेटल हो जाएगा. But जो मेरे टाइम के like whoever has done their dentistry in my time, the dentistry had a very big downfall. So everybody used to feel कि हम कहाँ आ गए हैं, why did we end up doing dentistry? That was the kind of mindset I had. It is not about कि मेरा काम कैसा था. It is about कि I did not believe in dentistry per se. I used to sometimes feel कि मुझे ये नहीं करना चाहिए था. I could have opted for a different career. I in fact thought of moving abroad so many times. In 2005 after doing BDS I wanted to move abroad क्योंकि ऐसा लगता था इंडिया में डेंटिस्ट्री का कोई स्कोप नहीं है. And similarly, after doing my MDS, I couldn't join a college as a trainer or something because I had a baby just after. So मुझे ऐसा लगता था कि I'm really stuck in a profession which is not going to give me anything. So my entire game changed after I joined you.
Okay, wonderful. So, and let me tell you something. This is very, common feeling, not just, in the minds of those who passed out like between 2000 to 2010 or whatever, but it continues even after that. Okay. How many of you agree? Type agree in the chat box. Okay. So, one of the worst thing that happens to us is, especially the doctors, the professionals is, you work so hard to become doctor, and you work so hard to become dentist. So whether you do your graduation, post graduation, and the point is, the moment you are done with your university degree, and in whether in like BDS, MDS, whatever, and the moment you are out, you are literally thrown in the world, which is not so kind, which is not so helpful, which is not so guiding. And you don't understand what should I do next. You don't understand where should I start this entire thing. And we become clueless. We become directionless. And then we'll end up doing whatever best we can. And that's the worst thing, because whatever best we can is like hardly anything, because nobody has taught us. So what is, from where the best comes? There is nothing called as best. It's just like trial, error, experimentation, and nothing like that. And as Hemlata says, worst thing is our fellow dentist jokes on our profession. Yeah, all the time. All the time. That the worst thing is, like, because people just don't have conviction in this wonderful field. People just don't have conviction and confidence, in themselves. Instead of, like fighting it out, people start trolling it out. Okay. And many of my colleagues have already joined insurance saying that there is no scope. Now imagine how painful it will be for them for the rest of the life. Because, you are a doctor, and at the end of it, what you are landing up with is being an insurance agent, being a real estate agent, or something like that. And see, you will make money. Everybody makes money. Okay. So irrespective of your business profession, you will end up making money, no problem. But money is not everything. At the end of it, when you stand in front of the mirror, okay, that is where you should be happy, isn't it? And that's very important. So so many directionless people here, in our country, in dentistry. And I want, like, using this opportunity, I am actually appealing you people to spread that one message, that it's a wonderful profession that can give you literally everything, anything and everything you want, provided you do the right things. Okay. And as Mansi has really pointed out, a wonderful, pointer about dentistry here. So guys, don't feel demotivated. You just need to do the right things. Okay. And how to do those right things? Yes, Mansi, have you started your doing those right things? And when?
So before I tell that, I want to say that there was a point of time I didn't want my kids to become dentists, and now I keep appealing to them कि तुम में से एक तो dentist बन जाओ.
And that itself is a wonderful thing.
Yes.
Imagine someone who had absolute zero conviction left in dentistry is now forcing or asking or requesting, whatever, the kids to become dentists. And that's wonderful, isn't it?
Yes.
So, and because as I always say, I'll tell you what, guys, the best of dentistry is yet to come in this country, let me tell you. Okay. But only for those who are prepared for it. Okay. So yes, Mansi has moved from zero to hero, no doubt about it. So let's hear from her how she moved from zero to hero.
So it was in COVID that I joined you. At that time, I didn't open my clinic for 4 months, and I was totally directionless what I have to do. And I filled forms to move to Canada. And as I told you, कि मुझे लगता था maybe the grass is greener on the other side. So and everybody used to keep saying कि dentistry has bigger scopes out of India. But and Facebook पे आपका मुझे वीडियो दिखा, and I don't know what clicked. I just joined that जो आपका सेशन होता है फ्री वेबिनार वाला, and I thought कि okay, it's a matter of that silver membership MDF journey. I thought let me see. I have never done this kind of thing ever before, and I joined you. And I have never stopped after that. One after the other, I'm a part of all your courses. I did MDF, I did gold membership, I did diamond membership. I am into Life Excel. I also opted for leadership this time, though I don't know, it is difficult, but I have opted for it. So I basically followed you blindly. और आपकी टीचिंग्स मेरे दिमाग में ऐसी घुसी हुई है ना सर कि मैं काम भी करती हूँ तो मुझे आपका कोई ना कोई फ्रेज याद आ जाता है. And it is very, very empowering. I must tell everyone कि as a mentor, if you follow someone wholeheartedly, तो आपको ना एक जो आप बोलते हो ना, जैसे क्रिकेट में एक एक्स्ट्रा, वो बस एक एक वो बैट को कैसे प्लेस करना है, वो ही इंपॉर्टेंट होता है. एंड दैट इज द चेंज यू हैव ब्रॉट इन माय क्रिकेट. So before joining you, I had as a clinic, I had a huge clinic, but I did not have a vision for that clinic. My dad used to say, इसमें OPG मशीन लगाओ, इसमें अपग्रेड करो. मुझे हर चीज एक बर्डन लगता था. एंड फ्रैंकली यू टोल्ड मी कि नंबर्स आर इम्पोर्टेंट. मुझे इतना डर लगता था, आई नेवर यूज टू चेक माई बैलेंस शीट. माई डैड इज अ CA, और वो सारा मेरा हिसाब किताब करते हैं, और मैं बोलती थी मुझे बताना मत, क्योंकि आई यूज टू फील कि मैं इनफ नहीं कर रही हूँ. आई यूज टू फील कि मेरे नंबर्स अच्छे नहीं है. आई नेवर यूज टू चेक माई बैंक अकाउंट्स. कुछ भी मैं अपना, आई हैव नेवर कैलकुलेटेड वेयर आई स्टैंड. बट आपने मुझे बोला कि द नंबर्स आर गोइंग टू टेल यू वेयर यू स्टैंड एंड वेयर यू हैव टू ग्रो. सो उसके बाद मेरी पूरी लाइफ आई ब्रॉट ऑन ट्रैक. आई डिड एग्जैक्टली वॉट यू सेड. And today I have an OPG in my clinic, I have a scanner in my clinic, I have everything possible. I do all the courses that a person should do to upgrade their skills. I do a kind of dentistry, I don't know about the patient, but it gives me so much of satisfaction that that is what I want to do. And that is what I feel कि अगर मैं dentist नहीं होती तो मैं और कुछ नहीं हो सकती थी. मतलब, you know, from a person who didn't want to stick as a dentist to a person who only wants to become a dentist is a great change.
Oh, that's very, very powerful, by the way. Okay. So person who did not want to continue dentistry is, from there to becoming a person who want to be a dentist only. That's such a proud thing, and that's such a fulfilling thing individually as well as, as a professional. And most importantly, it's a wonderful thing for our dental fraternity as well, because, getting this kind of confidence, getting this kind of conviction, and as I always say, it just take one bullet point, it just take one kick. And I'm so happy that, for many of you, the kick was the COVID times, actually, because that was the time when for the first time I got some time, and then I started doing some marketing or otherwise. Like before that, I never used to do anything. Frankly, time ही नहीं मिलता था. I was also very busy, occupied in lectures, courses, clinic, my own practice and all the stuff. So good that, like imagine someone who was not doing anything, was thinking of, migrating to Canada and something. And from there, now having OPG, now having scanner, do implants, have done all the clinical skill courses, all the soft skill courses. And it just, the journey is completely different. The practice is completely different. I'm sure about it. The practice is completely different. The type of patients you do nowadays, it's completely different. So guys, those of you who are absolutely, do this basic dentistry, I always say this, okay? The biggest problem in Indian dentistry is 90% of the dentists do, or maybe 95%, I can say, do only the basic treatments, the basic dentistry, and that is scaling, filling, root canals, crown and bridge work, and extraction denture, something like that. Now, the biggest problem with this basic dentistry is you cannot grow your practice beyond a point. And if you really want to grow a practice to a millionaire practice level, you really have to do so many patients and work so hard that you will burn out within few years. So it is extremely important to take your clinical skills. It's extremely important to take your, soft skills to a level where, apart from these 5 treatments, you start doing the next level dentistry. And that is nothing but, right from the implants to veneers to smile designing to, perio cases to flap surgeries to lasers. And that actually changes the entire game. So I have seen this happening for like hundreds and thousands of people in our community. And there's no reason, if you, just rise to the next level, trust me, the abundance is waiting for you. So, Mansi, just want to know what kind of, like what are the top 3 or 4, whatever things you learned from this millionaire dentist journey and Life Excel, and that you consciously implemented, and those became your game changer actually? So what are those few things?
So I started focusing on marketing first of all. We lag a lot, all of us doctors, we lag a lot in marketing. And one thing that I always remember when I'm doing is that you say that sabse pehle the quality of the content comes later, the consistency comes first. So I make sure that I post almost every day a story or anything on Instagram and Facebook. And frankly, I don't have a lot of followers right now on Instagram and Facebook, but what has helped me is the internal marketing. कि जो already मेरे patients हैं या मेरे relatives हैं या मेरे friends हैं, they see what procedures I'm doing, and it's not necessary कि कोई नया patient ही आपके पास आएगा. ये जो पुराने हैं वो भी देख के वो procedure feel करते हैं कि okay we are doing it and they come to me, so it helps me. Second thing, वही marketing में ही Google marketing. I have a very good Google presence now. Then I improve my staff training. I'm more staff की तरफ ज़्यादा sensitive हूँ. I understand what are their needs, and like you say कि छोटे छोटे पैसे पे focus नहीं करती हूँ. I give them what they want, but they are loyal and they are good to me and they work very hard. और आई हैव नोटिस्ड कि जब से मैंने अपने आप को अपग्रेड करना शुरू किया है, दे आर सो एक्साइटेड बिकॉज उनको लगता है कि उन्हें भी कुछ नया सीखने को मिलेगा. हमको क्या लगता है ना कि ये लोग को यही चीज करना पसंद है, बट इट्स नॉट लाइक दैट. इवन दे वांट टू लर्न. अच्छा मैम अब इसमें क्या करोगे, लाइक राइट नाउ आई एम डूइंग अ कोर्स ऑन एफएमआर, तो दे आर सो एक्साइटेड कि अब ये क्या चीज आपने ऑर्डर कर दिया. सो फॉर देम, besides money, that these trainings help them also to grow, and they also like to upgrade. um, then I have become better in my management skills. So I am focusing on my numbers, as you said. ग्रोथ में कैसे करना है, एक प्रॉपर चार्टिंग की, कौन से पेशेंट्स कहाँ से ज्यादा आते हैं उस चीज पे फोकस करना. सो ओवरऑल आई हैव काइंड ऑफ इम्प्लीमेंटेड ऑल योर टीचिंग्स. बट डेफिनेटली कोई महीना कैसा होता है, कोई मतलब लाइक it's life, it's going to be up and down always, but it's a wonderful journey I'm experiencing now.
Okay, wonderful, wonderful. Okay, so top 3 things which Mansi shared. First is marketing. So guys, let me tell you, dentistry is about 3M, right? And marketing, soft skills, and clinical skills. Our problem is we do not do marketing at all. Or and the other day I was mentioning it, I think in the Life Excel course over the weekend, that I ask so many dentists, what is your marketing budget? And they look at me as if कि है ऐसा भी कोई बजट होता है क्या, ऐसा कोई बजट करना होता है क्या या रखना होता है क्या? Yeah. See, no matter how good facility you have, how good setup you have, how good clinical skills you have, unless you tell the world how good you are, why and how they would believe you and why they should come to you. So marketing is that thing which give you patients in the waiting room. So never underestimate the power of marketing. Imagine, yaar, even today, if Amazon, Merck, and BMW kind of companies are doing marketing, Apple is doing marketing, Google is doing marketing. The entire world do marketing on Google. Think about it. Why Google need marketing? But everybody needs marketing. And if you're someone who is not doing marketing at all, whether it is online marketing, offline marketing, internal marketing, external marketing, if you're someone who is not focusing on marketing at all, trust me, you will always struggle from month to month. First of every month, and the first thing that you will have in your mind is, yaar, पिछला महीना तो चला गया, last month was good. Now, how will I be able to replicate the results this month? इस month में patient कहाँ से आएंगे? And if on the very first day of the month, you have this problem, then it's a big problem. Because even if you work for like 10 years, you will still have this problem in the 11th year. From where I'm going to get those patients from? So if you do very good marketing, marketing is that pipeline which keeps on giving you the patients. Okay. So that's one. The second thing which she mentioned was staff training, okay, and taking care of the people. Always remember, if you are someone who is good at managing people, what do you call it as human engineering, okay, or people management. If you are someone who is good at managing people, your life is always very sorted because they just take care of everything. And even if you are not there, things work. If those of you who really want to delegate and eventually automate your practice, start giving more time for your people, your team. Start doing more for them. And when you do, you don't have to do in such a way that they start getting the feeling that, if they go, you will collapse or something like that. उनके बगैर आपका पत्ता भी नहीं हिलने वाला. That feeling is not required. But be very genuine, be very authentic when you help them, when you teach them. And as Mansi said, that's very interesting actually. Okay, if your staff is very good, very positive, you add something new to the clinic, you learn some new treatment, you do some new course, and they are also equally excited what else is going to happen in our practice now. Okay, I have seen it so many times in my own clinic when I moved from like basic dentistry to everything we do now. And yes, the staff is excited. They also learn new things. They also understand new materials. They also understand new happenings. They also see new results, new type of patient reactions. Okay, and the compliments they get, and they are really happy. So wonderful. And that's the second thing. And third is, Mansi said, I became better at management skills. Management is the essence of life. I say it all the time. And the more you do it, the better you become at it. And that makes your life organized, that makes your life sorted. All of a sudden, someone, the older version of you who did not used to have sufficient time for everything, always in the firefighting mode, you start getting time for everything. All of a sudden you are like, I can do this as well along with this, and so on and so on. हर चीज के लिए time मिलता है. And that's why you should learn the management skills. You should learn people management skills. And marketing is very, very important. So wonderful. So as you started doing this, Mansi, what kind of results you saw? What kind of practice growth you saw in your practice?
So initially, I focused on investments. बिकॉज इतने टाइम से स्टैग्नेटेड प्रैक्टिस था. वो डिपेंडेंसी कि पेशेंट आएगा तो काम हो गया, दैट्स ऑल. बट देन नाउ आई थॉट दैट नाउ आफ्टर डूइंग द कोर्सेज ना आपको अपग्रेड करना ही पड़ता है. So after I started investing, I realized after, like, ये बहुत सारे डेंटिस्ट का क्वेश्चन होता है कि OPG लेना इम्पोर्टेंट है कि नहीं. So I would answer this here. After I bought the OPG, I realized that there are so many class 2 cavities, perio problems. So much of it is going unnoticed if we don't have an OPG. तो मेरा बहुत ज़्यादा practice upgrade and better हुआ after I installed the OPG, because एक तो patient को बहुत impressive लगता है कि you have this machine. It looks so huge and it has a very good feel on the patient's mindset. Secondly, patient comes for one cavity filling and there is so much more that we tell. So जो वो आप Pareto principle कहते हो ना, there is so much I do in one single day and उससे growth बहुत अच्छा हो जाता है. और पेशेंट को शेयर करते हैं ओपीजी, उसको ट्रांसपेरेंसी लगता है कि ऐसा नहीं है कि दे कैन ऑलवेज हैव अ सेकंड ओपिनियन. तो ओवरऑल ओपीजी ने मेरा बहुत हेल्प किया. देन आई इंस्टॉल्ड द स्कैनर. उसमें भी पेशेंट बहुत, क्योंकि अभी राइट नाउ नॉट मेनी डेंटिस्ट हैव अ स्कैनर इन हाउस, सो दे फील वेरी इम्प्रेस्ड. So overall, I would say कि initially my investments were more, but then after that they started reaping results. And April was my highest. This April was my highest ever in my life. And I thought इसको तो मैं break नहीं कर पाऊंगी, but it was to my surprise I broke my April record in May by a very huge number. तो I was so happy कि मतलब, and जो मई का मेरा रिकॉर्ड था, एक टाइम पे माय डैड टोल्ड, ही यूज्ड टू डू अ बैलेंस शीट फॉर अ डेंटिस्ट एंड ही टोल्ड मी दैट वो डेंटिस्ट ना इतना कमाता है साल का. तो मुझे लगता था पापा क्या बात करो, कोई डेंटिस्ट इतना नहीं कमा सकता. एंड माय मे वाज क्लोज टू द एंटायर एनुअल इनकम ऑफ दैट पर्सन. मतलब ये 10 years पहले की बात है, उस टाइम पे जो भी उसका था. So and this time when I told my dad ki I broke my record, he said, "Don't tell me the number." I was like, "I'm also not telling you the number. आप देख ही लोगे मेरी returns के time पे." But I'm really happy and proud to share that ऐसा नहीं है कि dentist गरीब होते हैं या हम कुछ नहीं कर सकते. We can do wonders if we believe, and the belief system you have changed for me.
Oh, this is so powerful. Okay. So, guys, imagine that this is the kind of transformation you can get. Okay. From like a dentist cannot make this much money to a dentist who can make that money in a month. Okay. And I always say this, right? No business profession in this world is good or bad. It is what you do in that business profession or, vocation that just change everything for you. So no business profession in this world is good or bad. It's just up to us. So if you actually just compare the numbers pre-COVID practice to your May high, okay, how much practice growth was that? Just you don't have to disclose the numbers, but like 2x, 3x, whatever. So what kind of like pre-COVID practice, which was a stagnant practice, to the highest practice that you had in the month of May? So what kind of growth you saw?
Sir, if I compare to pre-COVID, it was 6 times.
Oh, wonderful. And that's very, very powerful, isn't it? So so the whatever pre-COVID average practice was, okay, and now the May highest is the 6 times of that practice. And that's amazing. Okay, isn't it? So everybody just give a big congratulations to Mansi, because she not just did something miraculous, but also shared it very in the very right way. Because now, the OPG example that you gave, like I keep on meeting so many people literally every other weekend, and they're like, "Sir, dentistry may you have to invest a lot. So you buy OPG, and then now you have to buy CBCT, and then all of a sudden you have to buy scanner, and then something else will come." And so keep on investing the money, but then where are the results? Guys, I say this all the time. Results, when they come, you recover everything in a year or a couple of years. Remember this forever. Never be scared. Never be afraid of investing and upgrading. Any investment you make in your practice will always give you highest returns. And when the result starts coming, in a year or couple of years, you recover everything. And that's extremely powerful. And that's, that is where the biggest problem is, I have seen, honestly speaking, people think, about the course fees also. And I find it so funny and, frankly speaking, so stupid. And it's not just about our courses. Like if somebody wants to do, like a course on veneer, and the person is like, "Oh yeah, it's like 35,000 rupees. Boss, it takes only 2 or 3 veneers to recover the course fees. What else you want?" People think like for a couple of years to do that 1 lakh rupee ka implant course. Guys, it's nothing. You just need one implant patient to recover the entire course fees, and all the teachings are there with you for lifetime. Imagine the kind of money you're going to make. You're going to make like 1,000 times money from, acquiring those skills. The same thing applies to our courses. You learn the art of patient consultation, and it gives you lakhs and millions of rupees every month. So people should actually understand. Okay, people should actually understand how they should start looking at investment. Okay, anything you spend in the clinic is never, anything you spend in the clinic is never an expenditure. It's always an investment. It's always an investment. Remember. Okay. Josefa says nowadays it's always very difficult to select a mentor. Not at all, Josefa. In fact, over the years, now see, when all these upgradation courses have started in our country, okay, so there was a tsunami of people who started conducting courses. Let me tell you that. Okay, because people thought it's a money-making opportunity. But at the end of it, only those who were passionate about teaching, who were sincere and authentic about teaching, are doing well. So that tsunami has gone. As Warren Buffett says, it's only after the tide gets over, everybody comes to know who was swimming naked. Now the tide is over. Let me tell you this very honestly, irrespective of whichever course or whichever field you're talking about. The tide is over. Now it's very crystal clear in the country who is good in what. So you talk about, say, for example, implant, and you have those standard 4, 5, 6, 8 names, 10 names, whatever. So I'm not saying others are not good, but it's not very difficult to select mentors nowadays. You talk about FMR, and you will, when it comes to good FMR courses, you will not go beyond 5. Similarly, you talk about practice growth, and you know what are the names which comes up. Okay, it applies to everything. In fact, selecting mentor now is easy. It was difficult 5 years, 8 years back. Trust me. Okay, so all you have to do is to start somewhere. And let me tell you, when you select the mentor, okay, I'll tell you what, there are only 2 things which you should see, or maybe 3 things. Number 1, the experience of the person. Like if you want to work in the stock market and you're taking advice from someone who has zero knowledge about stock market, there is no point. Okay. If there is someone who do not invest in stock market, how can he or she teach you about stock market? Very simple. So experience. Number 2 is the authenticity of the person. Okay. How much authentic the person is, how much he or she is willing to share it, with you. And number 3, whether the person is approachable, accessible or not. If you work on these 3 things, trust me, it's not even a day's task to find a good mentor. You can take month, you can take a week, doesn't matter at all. Okay. So Dr. Shraddha, as a compliment for you, I met you in ExcelCon 23 and very kind-hearted, also available for help. Wonderful. So that's why she's our leader. Okay. So Mansi, as we close this wonderful speaker X session, your parting thought and a message to every dentist.
Sir, I would say that सबसे पहले work on your mindset. That is why all your courses start from the mindset, and it's the most powerful thing. If we believe in ourselves and if we believe in what we are doing, then only we can make others believe in ourselves, in us. तो पेशेंट आपका तभी मानेगा जब आप खुद अपने ट्रीटमेंट पे अपने आप में कॉन्फिडेंस रखते हो और बिलीव करते हो. So I would say that that is the most important.
Oh, superb, superb. And let me tell you, this is a super powerful share, huh? Because people just have different mental blocks. Okay, just now somebody has typed a question. I practice in a rural area and people don't have awareness about dentistry and all. Let me tell you, you practice in rural area, that itself is the mind block. कि यार मैं छोटे गांव में प्रैक्टिस करता हूं, यहाँ पे लोगों को डेंटिस्ट्री का अवेयरनेस नहीं है. Wrong statement. Wrong statement. Guys, I can show you a dentist who has a practice of 15 to 20 lakh rupees a month. The population of town is not even 1 lakh. Can you believe this? Now, don't say that rural area has a gold mine. Nothing like that. If there is a gold mine, the gold mine is here. Okay. Very powerful, Mansi. As she shared. Okay. Now, don't say unbelievable. Everything, you have to believe every single word I say, because I have actually seen, fortunately, Indian dentistry from every side. Let me tell you that. Let me tell you. Okay. So don't think rural area, urban area. In fact, I'll tell you something. There is more money in rural area. There are less number of dentists in rural area, and people have money, so they want to spend if they find value. All you have to do is to enhance your worth rather than anything else. Okay. So focus on growing your mindset. Focus on growing your clinical skills. Focus on growing your soft skills. It's way easier to build a massive practice in rural India as compared to urban India. Let me tell you that. Okay. So with this, let's conclude this Speaker X session. Congratulations, Dr. Mansi Arora, once again for your 6x practice growth. And don't worry, the highest 6x that you have achieved will eventually become your average for sure. Okay. Keep growing and keep making everybody in this community proud. So yes, wonderful. So guys, with this, let's conclude this Speaker X session. This is Dr. Sujit Pardeshi signing off from this Speaker X. I'll see you with yet another powerful Speaker X in the next Speaker X session.